Welcome to the Jefferson County Health Department Board of Trustees meeting. This is January 22nd, 2026, and it is 4 p.m. I will call this meeting to order. First order of business is Pledge of Allegiance. Please stand. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, folks, for that. Roll call.
Mr. Pig?
I am here.
Dr. Henry?
Here.
Ms. Stidham? Mr. Deal?
Here.
Ms. Taylor?
Here.
Thank you. We have established a quorum. Ms. Henry, would you please read our mission, vision, and purpose?
Yes. The mission is to promote positive health outcomes through delivery of foundational public health services. Our vision is a healthy Jefferson County, and the purpose of the health center, the JCHD, is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you very much. Next on the agenda, pardon me, approval of the agenda. Do I have a motion for such?
I'll make a motion.
I second it.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. I know we have one guest today, Mr. Liederbrand. Thank you for showing up. And of course, we do have our representative from the leader, so thank you very much. Next is the approval of the December 29th, 2025 meeting minutes. Do I have a motion for an approval?
I'll make a motion that we approve December 2029 minute meetings.
I'll second.
First and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next on the agenda is approval of the December 2025 expenditures for $159,950.14.
I'll make the motion to approve.
I'll second that.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is the approval of the December 2025 electronic payments for $485,303.91. Do I have a motion, please?
I'll move to approve those expenditures in that amount.
I'll second.
Having a first and a second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Now is the pre-approval for February 2026 electronic payments for an estimated amount of $610,463 and no pennies. Do I have a motion?
I'll make a motion that we pre-approve the electronic payments for February 2026.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Director's report, Mr. Sykes, the floor is yours.
Okay, thank you. Just briefly, I want to talk on the governor's State of the State address. I think one of the main topics we heard was on the state budget, which is typical for this time of year. It looks like he is looking at a reduction of around $600 million in fiscal year 2027's budget, and of course a lot of that could be within the core function. Some of that come from the core public health functions. They're estimating maybe 3.8 million, so that would affect us. I don't think we need to get too worried at this moment. We just need to be prepared, but this is the beginning of the state budget process. It now goes to legislation, which they will review and make their opinions and return their recommendations back to the governor for his vote or his veto, one or the other. So this is part of the process. But you know, when you take what he said, $600 million reduction from this year to next year's budget is what he is looking at. So, you know, we're, Missouri Department of Health, MOSIFI are asking us to help educate and advocate what we can. MOSIFI is going to have a Capital Day in March with people that can go up there and talk to their representatives at the state capitol. I think we're looking into that. We're gonna have a meeting next week of what we can do and not do, and we may take that trip up there as well.
Do you know what the date is, Steve?
March 10th is Capital Day, is what they're talking about. And I think that was planned even before the budget changes came out. They'd already planned on doing that just to showcase what local public health does. So I don't think it's indirect. They didn't schedule this indirect to this, this budget. The other thing, last month I talked about the Rural Health Transformation Program, the $50 billion project from the president. Missouri was, well, every state was awarded funding. Missouri, I think, received about the 9th highest awarded amount of over $216 million. And so this is being handled through the Missouri Department of Social Services, and really don't know how it's going to affect us locally. They're looking at developing regional healthcare units, I guess you could call, and where they would have hubs coming off of that throughout the state, and the money would kind of work through that. They're looking at doing a collaboration of all the players in health, not just public health, but hospitals and clinics, and coming up with how this money will be used and spent. So again, I guess like I said last month, it's kind of a stay tuned, and we'll see how that works. But that's a significant amount of funding, like I said, with 9th in the country of the amount that was given out. A couple of additional things I wanted to talk on, or one other additional thing. Gina just gave me an update today on the 2026 food and beverage permits. We have only 41 facilities remaining that have not renewed their permits. And that doesn't necessarily mean that there's 41 places out there that are operating without a permit. There could be some that are seasonal, they're closed, a food truck, something like that, that's not in operation. So our staff do contact these facilities trying to get these permits paid. It seems like the number is always going down every year of how many people do not pay. I don't know if you remember years ago, we were in March still trying to get several places to pay. So environmental, they're doing a very good job. They send these notices out November and 3 or 4 times in December of letting people give notice. This was the year we increased rates a little bit. We didn't have a lot of pushback. I think people understood that. I know it's not the favorite thing to do, but it seemed like they understood. So just a little update on those things. And that's my report.
Any questions from the trustees?
Steve, do you know if that rural health money will go through the counties or to the health departments?
So I think it's going to go through the social services will dole that out. And from my understanding, it's going to go more to these regional centers, and then that will go out to the hubs as well. So maybe there's 3 regions and 30-something hubs. And there's a pilot out there in the state right now. It's called Torch, and I wrote some notes down about that. But they're wanting to use that kind of a system on how the money would get spent with that Torch stuff. I can put some more together and send out and have for next meeting, but there's not been a lot passed down to me as far as local public health. I think there's been some other health centers that have been involved with the pilot projects. So
How about the numbers? Are you pretty sure about the numbers? The 4.7 million surplus that they had of end of 2026, I think that their numbers keep changing, and then the 8 billion surplus they had the year before.
Oh, you're talking on the budget?
Yeah. so I
Yeah,
wonder
yeah. So the
where-
state did have an $8 billion surplus, but by the end of, what I've been reading and researching, by the end of the fiscal year 2026, which ends June of this year, they'll be down to $4.7 million surplus. So there has to be something that gives there when your surplus is being,
Well, I saw that they found 250 million somewhere, a budget error or something.
yeah.
I wonder
So,
if that's
yeah,
gonna
there
be
could be
added to
more
that,
update to that.
Maybe.
Yeah,
They said that wasn't gonna change.
Yeah, right.
yeah. And that's what's, it's kind of sad. Doesn't change the $1 billion,
Change a thing,
but
yeah.
yeah.
Okay, thank you.
All right, are there any other questions on the packet that you were provided? Any of the program reports, questions on any of those?
One comment, they said that even though we're getting this money or may get this money, it's still not going to help Missouri as far as the hospital closings. It's not gonna,
The rural health,
yeah,
well,
not enough is what I'm asking.
I would think it would help the response to the closures of hospitals. Whether or not it'll reopen those that have closed, I don't know that. But I think that's one thing they're looking at is what's going on in the rural part of Missouri with health. And the closures of hospitals is a big deal. So whether it'll reopen it or shift everything in a different area, I don't know for sure.
I haven't looked recently, but with the cold weather that's coming, do we have anything about cold weather centers on the website or somewhere?
I thought we did. I think we do. Well, we got Brianne's back there, do we?
So we posted some information today, and we have stuff scheduled for tomorrow and Saturday as well. And then there's a link to the warming centers, the whole state warming centers, and you can zoom in on that.
Okay, great, thanks.
Okay, I will point out one thing that was in the packet. There is a blood drive here on Thursday, January 29th, 1 PM to 6 PM. So bring yourself and give some blood. Thank you.
Bring it with you.
All right, I don't believe there's any public comments. All right, so we're going to slide into the old business, which there is none. And then the next portion is new business. First on that agenda is act on a recommendation to change the dates of the Jefferson County Health Department Board of Trustees monthly meeting. I need a motion on that, please.
I'll make a motion.
We have a first, do we have a second?
I'll second.
All right, we have a first and second. Mr. Sykes, do you wish to explain this?
So, right now, our meeting is set, that it's the fourth Thursday of every month at 4 o'clock, which works typically, except for 5 months, we have an extra Thursday. We were wanting to know if we could just move it to the last Thursday of each month. That way, our financial reports, everything like that, is for the whole month and not one more week remaining. It just makes everything a little more streamlined. Even our other reports would be taking in the whole month. So 5 months out of the year, we have a fifth Thursday, I think it's how it works. And we just we'd keep the time, the day the same, it's just it'd be the last Thursday of each month. So from what I can look, what I have found, we had a resolution in 2017 that set the board meetings on Thursdays at 3. Then in 2022, we changed it from 3 o'clock to 4 o'clock. I think that we had a lot of back and forth on the time, so it was moved to 4, and that was done by a vote of the board. So we were just wanting to know if we could move it to the last.
My first question would be to Ms. Coleman, excuse me. Do we need to have that in a resolution, or can we just vote on it?
Do it as a agenda item and make
Okay,
motions today.
all right.
Your motion would be, though, to rescind the original
Is there any legal issues around that?
Even the way it currently is, it allows the board flexibility in when it sets its meetings, so it's just formalizing it.
Want me to make a motion to
To vote on it?
If you wanna,
rescind first? I'll make
well,
a
it's rescind
motion to
and-
rescind the former date and move to the last Thursday of the month
At 4 PM.
at 4 PM.
Do I have a second for that motion?
I second that.
So we have a first and second on a motion to change and rescind the current policy and move to the recommended policy where it'll be the last Thursday of each month at 4 PM. All right. Any other discussion points?
Okay. So that will start immediately, basically.
I would presume.
February is already the last.
Yeah,
I didn't hear you.
it will start immediately next month if we need it, or whenever it starts.
Right, well, I think.
Whichever
March,
month is
I
that.
think,
March.
All right.
Yeah.
Is there any other discussion points? Not hearing any, roll call, please. Put you to work.
Mr. Pig,
Yes,
Dr. Henry,
Yes.
Ms. Stidham, Mr. Deal, Ms.
Yes.
Taylor.
Yes.
motion carries, thank you.
thank you.
Next on the agenda is act on recommendation to amend the Jefferson County Jefferson Franklin Action Committee, how's that?
Community action.
Community Action, WIC, lease.
So-
Easy for me to say. Do we have a motion on the table for this, please?
I'll make a motion.
Need a second, please?
A second.
Having a first and second, Mr. Sykes, again, explanation.
So last month's meeting, we reviewed the lease agreements that we have, and we passed the lease agreements. When we sent that to Jefferson Franklin Community Action Corporation, I wrote it out, so I got,
Thanks.
they responded asking if we could change the lease terms to a month-to-month or a 6-month lease. They are looking at possibly moving out of the facility and combining locations. I'm not for sure the whole plan, and now I don't want to talk on their behalf, other than they are looking at other locations. So I talked with Mr. Crawford and Christie as well as the best way. I wasn't so sure a month-to-month was what we wanted to do. Really, the terms of the lease, I don't think it's a big issue. I recommended that we just put in there that they give us 30-day notice, we can terminate the lease. It seemed easier to me. Plus, I think it works for them as well, because I don't know if you're out looking for a building and want to get moved, if you can do that quickly. So if it doesn't happen, they still can stay there. So we wanted to add to the, amend the lease to say, and I don't have that right out in front of me. I think,
It's not a strict 30 days either, it's 30 days from the first of the next month. So if they told you on the 14th of January, then they would be out by the end of February, not the 14th of February. So you don't have to worry about refunding any kind of lease.
so we put the wording, and it's in your packet. In the event the lessor or the lessee determines that they would like to discontinue this lease, they can choose to cancel the lease, provided that a 30-day notice is given from the next payment due date. I talked to them about that language, they seem to be okay with it. So,
And
but
your
I,
recommendation is to do this, right?
yes, that's my
Okay.
recommendation.
Any questions, discussions, trustees? So we do have a first and second, I'm sorry.
I don't think that would be a real budget issue for us. It's $700 and some dollars a month, right?
Right, yeah, no, it's not gonna really hurt us any on that budget.
Motion?
So I believe the motion would be to amend it to basically a 30-day out clause put into the current lease.
Correct.
Okay. So can we go ahead and have a motion to that effect?
I'll make a motion that we accept Steve's recommendation.
Okay, for a 30-day out. Do I have a second?
30 days.
I'll second.
Having a first and second, is there any other discussion points on the matter? Not hearing any, roll call vote, please.
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham, Mr. Deal,
Yes.
Ms. Taylor.
Yes.
Motion carries. Now we have act on recommendation to approve grant application for Jefferson Foundation. Do I have a motion?
I'll make a motion that we approve the grant application for the Jefferson Foundation.
Do I have a second?
Second.
Having a first and second, Mr. Sykes, you're up again.
So according to our bylaws, anytime that we would like to submit a grant application that would be over $100,000, we need approval from the board. So that's what we're doing here today. This is a grant that we routinely do each year, but I want to ask Katie Bilmerbeck if she'd come in and talk about it. She's the one that submits the grant and oversees the grant, to give you a little more idea what this is about. No, I don't think, no.
Maybe in the packet. We could share one.
Yeah.
Okay.
You got enough, good, everybody's getting one. Thank
I
you.
want my own.
Okay, so, I just handed you the description of what we want to do for the Jefferson Foundation. And if I could bring your attention to the second paragraph, under background, it states in there that during the 24-25 grant cycle, Jefferson County Health Department provided over 2,600 services to our residents, and that totaled almost $80,000. So what I'm here to do, real quick, is just to offer you some examples or scenarios that those numbers don't necessarily always cover. So, this grant is for uninsured and underinsured Jefferson County residents, and the focus of it has always been access to care and prevention. So, if you go to the doctor and you don't have insurance, it's super, super expensive, right? And so, you're going to the doctor, you're paying the doctor for your visit, whatever else they may need to do. So they give you a prescription for your labs, CBC, CMP, all those blood draws that you have to have every year so that you know that you're doing well. And so you call Quest, and Quest tells you that it could be upwards of $500 or more to potentially have those labs drawn. And we don't really know a lot about that because we have insurance, so the doctor draws it while we're in the office, and we don't ever see that. So many of our county residents cannot afford that, and so they just don't get their labs done. One of the caveats of this grant is that we can provide those labs for those patients at no cost, okay? So we're talking $500, $600, $700, $800 worth of labs on the regular that folks are able to get through us at no cost. We do quote them the price of what those labs would be. We also tell them what it could have been at Quest, and then we ask them if they have anything. You know, if you can put anything toward it, you can. You absolutely don't have to. One of the other things on that, too, is they can also just go straight to our mobile unit and cut out the doctor. Not that we want to cut out the doctor, but it costs them way less. So our visits on our mobile unit are $30. So they can go on the mobile unit, they can see Mary, the nurse practitioner, they can get their labs, they can get everything done, whatever they can have done in that visit for $30, okay? We also take our kids' dental van to the schools. This requires no missed school, no missed work for the parents, and if the child is uninsured, we're able to significantly reduce the cost of those dental services. So we charge $75 for everything that we can do for your child in a year. So a lot of these kiddos are having extractions or fillings, they're getting their cleanings, they're getting their x-rays done, $75 for the whole year. We've also initiated a program in 2021 called Project Lifesaver. And so inside this little blue box is a transmitter. These transmitters are $350. The program is set up for folks who wander, so it could be for Alzheimer's or kiddos who just run. The Jefferson County Sheriff's Office has a transmitter, like responder thing, that can track these, and it's not like cell phone. So for 1 year, for a person to be on this program, the approximate cost is $450. We do this for those folks for nothing, so they don't have to pay anything. We also purchase hygiene items to place in the blessing bags for the unhoused. We purchase lockbox bags and boxes for medication. And then we've just recently started a new program with, who is it with? St. Louis Diaper Bank for period kits. So these come to us in big trash bags, and we've just recently had to increase our request. So this started in 2025, and just already in 2026, we had to increase our request. So we're getting more period kits that we're handing out to people at no cost. So many things. I just want to touch on those few. If you guys have any questions.
So historically, have we been able to spend all the grant money?
We do.
So is there any stipulation if there's leftover money, what to do with that?
So if there's leftover money, it goes back to the foundation, but we have never had that situation happen.
Okay.
It also goes, so not just services in the community, but it also goes toward program support as well. So there are some things that we can purchase that aren't necessarily services that
Right.
would help with program support.
Okay, good, thanks.
I think that 200,000 is enough, or?
So wouldn't we love to get more? The maximum request for those is 250,000.
Okay.
Historically, we've requested 250,000 every time. Last year, we switched it to 200, and we typically get 175. But I also think that the paper reports that we're usually one of the highest beneficiaries of that money.
That's good. Thank you.
Thank you very much.
Thank you.
Excellent program. Would somebody like to make a motion to, I guess it's apply for this grant, correct?
I'll make the motion.
Second it?
So there's a motion to apply to the Jefferson Foundation for a grant of $200,000. We have a first and a second. Is there any further discussion on the matter? Not hearing any, roll call, please.
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham, Mr.
Oh.
Mr. Deal,
Yes.
Ms. Taylor.
Yes.
All right, Mr. Sykes, do we have any CDC or FDA updates?
Yes, we do. I want, real quick, thank you, Katie, for doing that. She makes things a lot more exciting than when I talk, so I thought it was good to have her come in and give that overview. Yes, we, recently, the CDC did come out with some changes on their immunization recommendations. So I asked Melissa if she'd come and speak on what those changes are. So Melissa, please.
Good afternoon.
Good afternoon.
So on January 5th, the U.S. Department of Health and Senior Services issued in the form of kind of a press release, a fact sheet about recommendation changes to the childhood immunization schedule. They also issued on that date.
Raise your mic up a little bit too.
Is that better? Yes. Okay. They also issued on that date a revised recommended childhood immunization schedule. So just briefly, the changes separated the recommendations into 3 categories: recommended for all children, recommended for high-risk groups, and recommended based on shared clinical decision-making. So, yeah, it looks a little different now with those 3 different groups of recommendations. Shared clinical decision-making is kind of what we do on a daily basis with every patient that walks through the door. Especially for immunizations, we take into account their medical history, what the their current status of immunizations are, what they are requesting as far as immunizations, and we also look at package inserts and provide them insert guidance. So that shared clinical decision-making kind of encompasses all of that in the discussion between the healthcare personnel and the patient and or parent guardian. Okay? Any questions about those three different categories?
Is that going to change school immunizations?
So that is a fantastic question, right? So there is a difference between the CDC recommendations and what's required for Missouri State schools. The immunizations that are required for Missouri State school children are based on Missouri State statute. Right now, there has been no changes to the Missouri State statutes for 25-26, nor for 26-27 school years. So that could change, right? As those recommendations change and as things roll out, it's possible that the Missouri statutes start mirroring what that CDC, those updated recommendations are. But right now, there's not any changes for the school-based recommendations. We think we're covered by these changes based on our standing orders from our medical director that specifically say we're going to look at CDC recommendations, we are going to look at what the patient or parent is requesting. They are making the appointment. We're going to look at the package insert. We're going to give them guidance. There's a two-way conversation before we draw up any vaccine. And then after that two-way conversation, when the patient or parent guardian decides this is what I want to get my child, or this is the immunization that I would like to receive, as long as it follows those recommendations and we aren't going off label, then we're able to provide that.
Is any of this going to affect the funding for VFC or any of the other immunization programs?
That's a really good question, too. Right now, it looks like there should not be changes in the funding for VFC, and based on what we know right now, the insurance companies have stated they're going to continue to fund all of those recommended vaccines. I do have some more information. If you would like some additional information, I can provide that. But I think right now, we're just kind of waiting to see what follows that release that came out on January 5th. But we think we're still covered in all the categories. So just a matter of following those details as things further roll out.
Is there any other questions? Thank you, Melissa. I know it's keep apprised of that, and I know it's a tough job. I do appreciate it. Thank you.
Thank you.
Thank you.
All right, we're looking to entertain any topics for the next agenda by any trustee. Not hearing anything, I'm going to move on. All right, next is closed session. Who would like to make the motion to go into closed session?
I move we go into closed session.
Do I have a second?
I second it.
So the motion is going to closed session. This is pursuant to 610.021. Any confidential or privileged communications between the Board of Trustees of the Jefferson County Health Department or its representatives and its attorney. And also shared records which are protected from disclosure by law. There's only two things. It's the approval of the minutes in closed session and a litigation update. So we have a first and second. Is there any further discussion on that matter? Roll call.
Mr. Pig?
Yes.
Dr. Henry?
Yes.
Ms. Stidham? Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Will we have anything to report out? Okay, so we will not have anything to report out. You can be back, but it's not going to be anything there. So thank you, folks.